that's my favorite fact to tell people is that you can have the same vulva at 20, at 100 years old.
Now, if you could teach the world one essential insight about sexual health, something that really moves the needle, what would that be?
The fun fact, the vulva has the capacity for regeneration. You can have the same vulva at 20, at 100 years old. It is optimal vulvar health. The vulva is dependent on hormones, and our vulva is constantly changing. Literally, with every cycle, our vulva changes. Every life phases, our vulva changes. But the beauty of this is that those changes, which can be dangerous and can have really bad impacts and cause pain and an infection and sometimes death, like recurrent UTIs can also be caused by poor vulvar health. There's no reason as to why we allow this very vital tissue to become diseased and unhealthy. Like we have the medications, they're there, they're available. It's just now the advocacy around this. And so that's my favorite fact to tell people is that you can have the same vulva at 20, at 100 years old. And it's just optimizing our vulvar health because that not only helps our sexual health, and like that's very important, but some people don't want to have sex, and that's absolutely fine. But it also optimizes your bladder health. We have new research that was just accepted and it's going to be published coming in months that showed a link between poor vulvar health, an unhealthy vulva, and recurrent UTIs. So your vulva is directly linked to your bladder health. So many people are suffering from recurrent urinary tract infections, especially after sex. And they think it's something in their urinary system, their kidneys, the tubes that drain their kidneys, or something in the bladder. But actually, a lot of those symptoms can be coming from the vulva. And so, if we actually knew how to examine the vulva, we knew how to keep the vulva healthy and be able to spot disease early, we could be preventing UTIs. And so, that's something that I will keep screaming from the mountaintops because I've had so many patients that have come to me with debilitating UTIs. We find out that it's just the vulva. We know that there's amazing, cheap, fun medications that can repair the vulva, and they never have UTIs again. Like that is,
Wow.
we're able to give people their life back just with simple science and having an algorithm and knowing how to use it.
Okay, so now I'm going to go off script here. So I'm a mom of three, and two of those children are my daughters. So as a mom, what should I be teaching my young daughters? They're 8 and 11 right now about vulvar health.
Yeah. I love this question because it touches such a nerve for me. I remember I grew up in a family where having female genitalia was shameful. I still remember the conversation I had when I got my period for the first time.
Yeah.
And my mom told me this is the most shameful secret. Don't tell anyone. And I was like,
Wow.
I feel like that's not right. Like I was
Oh,
like 10 or
no.
11 and I was like,
Yeah.
that can't be right. I think she also told me like if a boy touches me, I'll get pregnant. I was like, oh, this lady doesn't know
Ooh.
anything.
Oh, no.
What it is that's actually generational trauma. That's the generational trauma because that was a conversation that she probably had with her mother and
Yeah.
her mother and her mother. And I see that generational trauma all day, every day. Whenever I do an exam for someone coming in with vulvar issues, whether it's pain, infection, difficulties with arousal sensation, when I do an exam, almost every single patient apologizes for their body. That is ingrained culturally. When I have male patients or patients with penis, they don't apologize for their bodies. They're not like, oh my
Yeah.
God, I'm so sorry you have to see this. They're like, okay, like drop trowel, let's go. But every single patient with a vulva that I have to do an exam on apologizes for their body. That is the culture of shame. And so one of the things I would talk to your kids about is not being ashamed and not being afraid of their own body part.